The U.S. is headed for a child care cliff, as pandemic emergency relief funds that helped thousands of child care centers pay staff, improve facilities and keep costs lower for parents expire. According to one estimate, many 70,000 childcare centers could be at risk of closure and many 3.2 million children could lose their places after the fund expires on September 30. The soon-to-expire funding stems from the American Rescue Plan Act, the $1.9 trillion stimulus plan signed into law by President Joe Biden in 2021. Nearly $40 billion was directed to the child care industry, helping a sector that often receives little support from the federal government. This funding allowed child care operators to stabilize their businesses during the crisis, in part by increasing their workers' wages and preventing them from leaving higher-paying jobs. This was an issue where many competing employers increased wages to attract new hires. Tight job market. But some child care centers have also used the funds keep prices lower parents, many of whom are already struggling to pay for care, which averages $15,000 a year child. 53 increase from decade ago. According Care, We Know Money Works, more than 220,000 child care programs have been funded. Julie Kashen, Senior Fellow and Director of Women's Economic Justice at the Century Foundation, told CBS MoneyWatch, "It was exactly the lifeline that was needed." He added, "This is first time the federal government has spent this much money to secure child care sector. This shows us that when we do this it will make a big difference." But without funding, Kashen estimates a ripple effect would lead to the closure of 70,000 child care centers, putting 3.2 million children at risk of coverage. This, in turn, could impact the ability of millions of parents to continue working, ultimately costing them $9 billion in lost earnings. He said, "A broken business model at heart issue is federal government's role in supporting child care and whether increasing support could help parents who want to work but are forced to step back or reduce work hours because of cost." Early childhood programs. Kashen noted that other rich countries spend about $14,000 a year on child care, while the United States spends about $500 a year. The difference can be seen between USA and Denmark. Here, second country guarantees child care for children over 6 months and government pays 75% of costs. In Kashen's view, it's no coincidence that the share of women in the U.S. workforce has recently reached record levels, a trend Kashens attributes to ARPA funds that support child care centers. "If we don't have child care, we can't get everyone who wants to work," she said. "The child care sector is now more stable than in the past, and this has made a big difference in supporting the employment of mothers." Susan Gale Perry, CEO Child Care Aware of America, a national network more than 500 child care resources, stated that ending ARPA funding will bring